Hi everyone, this is Aneshri Mudli and I am a psychiatrist practicing in Cape Town. I wanted to chat to you briefly about a very remarkable emotion that I'm sure we have all experienced, which is anger. Now, I have seen in the past weeks, most likely as a consequence of the lockdown, as well as the financial, especially the financial, as well as the social and emotional implications of the lockdown and the coronavirus pandemic, a rise in the presentation of anger, or of people presenting with more and more complaints of feeling irritable, angry, having outbursts, or feeling frustrated. And so I thought it's probably worth speaking a little bit about anger. So anger is actually a very normal and in most cases a healthy emotion that fulfills a very important purpose. It is evolutionary in origin. Anger is a defensive emotion that allows us as humans to react or respond to perceived threats. And anger consists of a very complex combination of a physical response as well as an emotional response. So the physical response would be as a result of the physiological reactions occurring within the body when one experiences anger. And this primarily involves the neurochemicals called adrenaline and noradrenaline. And as a result, you would experience a rise in your blood pressure, a quickening of your pulse, sometimes a flushing of your cheeks, so feeling warm or pink in the cheeks, sometimes feeling tremulous in your body. But essentially, it is a heightened sympathetic response, or physiologically, as I said, an increase in your adrenaline or noradrenaline that causes the physical component of anger. Emotionally, anger is experienced on a spectrum ranging from mild irritation right up to fury and rage. And any individual is likely to experience multiple experiences of anger at various points on that spectrum. So in other words, you might have a day where you feel mildly irritated with someone, and then you might have a moment or two when you feel absolutely furious at a completely different situation, or perhaps even at the same person or circumstance. And I think anger has escalated or become more frequent because, as I mentioned, of very difficult financial, social, and emotional consequences or experiences during the lockdown. Now, anger can be expressed in three main ways, or one can think of it in three main ways. And that would be A, being expressing anger in a healthy way, B, suppressing anger, which is ultimately unhealthy, and C, which is calming down or calming one's own emotions down and regulating the anger. Now, A, which is expressing anger, is of course the ideal way in which one would want to express anger, and the way in which most of us get it right on most occasions, but some of us don't. So this would entail respectfully expressing how you feel to the next person, so using kind words or keeping your words considered even if they're not exceptionally kind, being respectful, being assertive, so being able to say what you need or what you like or what you don't like, but being able to communicate ultimately in a respectful manner. Now the key to this is to being able to pause and to be able to collect your thoughts in such a way that you can express yourself in a very reasonable and rational manner. And that is why it is ideal and not always possible, because we are, after all, emotional beings as well, and emotions such as anger can sometimes get the better of us. Now, suppressing anger. Suppressing anger is actually very, very common, and I see this frequently in my clinical practice. And this is essentially when an individual will push down the actual experienced emotion, being anger, and will replace it by another emotion, which of course it would be an untrue emotion. So either pretend or wear a facade of being calm or of being happy, when actually on the inside they're anything but calm or happy. They might distract themselves by doing some sort of a task or by watching TV. And again, this is suppressing or pushing down the real experienced emotion and suppressing what they would actually really like to do. And suppressing anger might be a result of either inability or not knowing, not having the skills or the know-how of how to express anger in a healthy way. It could be so inability and not knowing how. It could be because of incorrect learned behavior. So in other words, to flesh that out, one would say or think of how we grew up, the environments in which we grew up, and how we watched the adults around us communicate their anger or express their anger. And if we are surrounded by adults who do not express their anger and often also suppress their anger, then it is very, very common that children will learn to mirror that experience, and we will then copy that experience and also suppress our emotions because of not knowing how, not observing people do this in a healthy manner. Or believing that this is the healthy manner, that suppressing emotions, not talking, and rather distracting oneself is a way of being in control and therefore the better way of managing things. That can happen. The other extreme could also be happening where children grow up in an environment where there's excessive amounts of emotions being expressed. So very chaotic emotional environment where emotions are very dramatically expressed. So intense anger, intense sadness, intense happiness, etc. And this, as one can imagine, can be experienced as very overwhelming, very chaotic. For a child, and therefore they might learn unconsciously to do the opposite, so to want to gravitate away and therefore suppress emotions for fear of the chaotic, overwhelming feeling that might arise if one were to indulge in emotions. So suppressing emotions is of course very unhealthy and very unhelpful, because ultimately those emotions will surface and will be expressed most likely in an unhealthy way themselves. And often the most common and the classic way in which suppressed anger expresses itself is in the form of passive aggression. And a classic example of passive aggression, which I'm sure we've all either experienced and or been guilty of expressing or doing ourselves, is the silent treatment. Now, the silent treatment has no real good outcome. It serves to make people feel extremely uncomfortable and tense. It also makes people feel, wonder or doubt what's going on, has they done something wrong? So it makes them question things in a very unhealthy way. And it leads to unhealthy communication and dynamics within a relationship. The other thing about passive aggression is that it allows tension to build, and that tension will eventually come to a head. And that's also something that I wouldn't recommend as a psychiatrist, and I'm sure that if you've experienced it, it's also not healthy for the relationship. So essentially it hinders healthy communication of one's feelings or thoughts and needs. And that's ultimately what we would want in our relationships, whether it's at work or personal relationships. We would want to be able to learn how each of us can communicate our needs and our likes and our dislikes in a healthy way that can be not just communicated healthily, but also received in a healthy way. Because remember, relationships are two-way streets. So anger can be experienced either because of what someone has said to you, or how someone has said something to you. So when we speak about healthy communication and not, for example, unhealthy communication such as passive aggression, we're looking at both sides, so receiving as well as giving communication. And then the last way in which anger can be expressed, or is expressed, I guess, is calming down or regulating your anger in a healthy way. Now, this is the most sophisticated way, and it does require quite a lot of practice and possibly life experience, because this means essentially it's a very complex sort of concept, and it's very therapy based. Is that you would experience your emotion, such as anger, but you would not become your emotion. So, in other words, you'd experience it, you'd feel it physically and emotionally, but you'd almost observe it. So, experience it, but observe it, and allow it to sort of like a wave wash over you, but don't get drowned in the wave. And you'd then be able to think about the emotion and ponder, what could have triggered it? Why are you feeling this way? Is it because of that work meeting that didn't go well? Is it because of how your partner spoke to you early this morning? And then being able to work through it in a very calm manner, and then eventually develop a strategy of how you would tackle this issue and find a path forward. So this really is about being in control, but still experiencing all your emotions. It is quite a sophisticated way of expressing anger, and it takes a lot of time and a lot of practice, so a lot of commitment and dedication to this way of expressing anger. And then, of course, once we've spoken about A, which is how to express anger healthily, suppressing anger, B, and then C, controlling or being calm during your anger. So those being the core ways in which anger is expressed. Then, of course, ultimately, I guess, what a lot of us would like to know is how to deal with the anger, and when to know that you need help, professional help, to deal with your anger. So firstly, maybe we'll look at how to know when to seek out professional help. And as I said earlier, anger does exist on a spectrum. So if you find yourself or loved one repeatedly having furious outbursts or falling into a rage, then the frequency of those outbursts and or the intensity of the outbursts. So it either could be the frequency, so it's happening so often, or it could just be one, but that the disproportionate nature or the intensity of this outburst is so extreme or so severe that would point you in the direction of needing help. So frequent outbursts or intensity. Intensity would be complete loss of your temper, maybe throwing items or damaging household or work items, so kicking in a door or punching out a window. Maybe hurling personal insults at people. That alone, is very damaging. So it's not just physical anger, but also verbal or emotional anger. Throwing things at people, of course, is abusive, and that definitely should be dealt with, and that person should definitely get professional help. And of course, if it escalates to even more severe physical aggression, like shoving someone or shaking them or even beating them up, then that certainly does require a thorough psychiatric and psychological evaluation, and then a treatment plan to be drawn up. So that's when to know that you need to go and get some help. Then looking at what is the help that is available. Well, firstly, one of the key things that we would do as a psychiatrist is, in a comprehensive assessment, we ensure that there isn't any physical medical cause for your anger. So it's not related to a thyroid problem or any other disorder in your body that might be occurring. And if it is, we would do a bunch of blood screens or tests, and if anything comes back as positive, then we would treat that or refer you to a specialist to get that treated. Secondly, is that we would do a screening psychiatrically and psychologically to check whether your anger could actually be the manifestation of an underlying illness or disorder, such as an anxiety disorder or depressive disorder or any other mood disorder. Because oftentimes anger might be the presenting symptom, so it's the symptom that gets a lot of people's attention in your family or in your workplace, but actually underlying that might be, for example, a depressive disorder. So we would do that, and if we find a psychiatric illness present, then of course we would treat that illness with a combination of therapy and medications, depending on whatever is appropriate for that situation. Then the next thing, if we look directly at anger, so say there's no other medical disorder or psychiatric disorder present, then we would look at specifically addressing emotional regulation. And there's a variety of techniques that can be used. There are books and textbooks and vast amounts of scientific research into this field. So in basic, I'll just give you the basic principles, is that we do a lot of relaxation exercises with clients, which usually focus on breath control, as well as on deep muscle or progressive muscle relaxation. We also look at other distraction techniques where, however, the distraction technique is not being used as a long-term suppression of anger, but rather a mechanism to try and get the person to disengage from the escalating anger, so to prevent or diffuse the situation, so prevent them from escalating into a rage or fury, and then calming them down or getting them to step back and pause. So the distraction technique would be used to get that pause, and then later on, when the person has physiologically and emotionally calmed down, that person will then be taught how to engage with the emotion and break it down, look at what could have caused the emotion and what are better ways in which to communicate or express one's emotion. The other thing that we look at is, so we're teaching you basically how to de-escalate your emotions. The other thing that we look at when we look at anger is, of course, firstly examining your existing expressing skills or communication skills, and then looking at where we can improve that. So looking at what words can be used, what words should probably best stay away from, such as when you're having a heated discussion or tense discussion, avoid phrases like "you never do this" or "you always do that." Whether you're speaking to a work colleague or partner or loved one, phrases like "you never" or "you always" often come across as very negative and very punitive and very offensive ultimately. So they might lead to escalating the argument rather than de-escalating and trying to find a path forward. So we look at communication and language used very carefully. We look at body posture, at facial expression. So it might also be a good idea for you to sit down. Once you've had your pause, you've collected your emotions, and that might take a few hours, a few days, depending on the intensity of emotion and on the actual circumstance. Once you've had that pause, then we would say, we'd look at the situation and give you advice depending on whatever is troubling you. And you would then obviously learn to replicate these skills, that it might be better to sit down and have a face-to-face conversation with someone rather than over the phone or rather than standing. We would suggest things like have a discussion in a quiet room rather than in a busy bar or cafeteria. We would suggest perhaps also, if you're very intimidated by a partner or some person, that it might be better to have that conversation in a restaurant where you're still afforded good privacy, but where you're surrounded by people and know that you can leave if you need to. So we look at a range of skills that we help you build and develop. So again, that would be breath skills, muscle relaxation exercises, communication skills, language to use, facial expression, body language, as well as distraction techniques to allow you to take a pause. Of course, we also stress taking a pause, taking time to collect your emotions. So we do a lot of role modeling and so on, or modeling behavior, in the practice session, so that you get a feel for what is expected of you in reality. Okay, and that's just basically a rough outline on some of the therapeutic techniques that can be used. As I mentioned, medication can also be used if we find that there is an underlying disorder. Okay, I hope that was helpful. Take care. Bye bye.